Good evening. I'm Dorcia Simmons, Chief of Staff for Fulton County Commissioner Marvin Arrington Jr. Commissioner Arrington serves Fulton County District 5, which encompasses the city of Atlanta, East Point, city of South Fulton, and very small parts of College Park and Union City. Unfortunately, due to connectivity issues while he's overseas, Commissioner Arrington will not be able to join us. However, he does send his hellos and still thought it important to be able to share this very important information with you. Before we begin, I would like for you to mark your calendars for our annual Family Fun Day on Saturday, May 1st at Oak Hill from 11 a.m. to 1 p.m. Now, this is Family Fun Day with a twist. There will be a drive-through because we are still in the middle of a pandemic. There will be a food giveaway thanks to our sponsor, Hosea Helps. And we will also give away free masks, hand sanitizers, and there will be opportunities for vaccination appointments thanks to our other sponsors, the Fulton County Board of Health. So without further ado, I would like to introduce to you Dr. Lynn Paxton, the Director of the Fulton County Board of Health, who will share with us all things COVID-19. Dr. Paxton, thank you for joining us this evening.
Thanks for having me. A pleasure to be here. Would you like me to do the presentation that I sent you, or should I just talk?
Yes, you can start with the presentation, then after that, however, whatever.
Okay, I can share it from my screen if you'd like. Let me see if your thing will allow me to do that. Share screen. Okay, thank you. All right, can you see that? Is it coming up on the screen?
Yes.
Okay. Well, what I'm sharing with you all today is the basically this is a condensed version of the presentation that we look at about 3 times a week. Fulton County Government, Board of Health, and all that has basic information. So I am just showing you that. Let's see. I can't seem to advance the slides. I am not quite certain why my thing is not working to advance. Okay, we might have to have somebody there.
Yeah, Dr. Paxton, what we'll do is, if you have them, then what I will do is I'll make you a co-host. And then you can share your screen.
Okay, that's fine.
Okay.
All right. Okay, it looks like I'm screen sharing now, so that we should be able to go from the beginning. So as I said, this is the slide set that we look at many times a week. So I'm just going to give you the highlights of it. And so this slide here just gives you an overall view of what has COVID looked like in Fulton County and our surrounding districts since the beginning of the epidemic. Now we're just a little bit over a year in. I mean, it feels like it's been a century, but we've only been dealing with it since basically since March of last year. And so you can look at, these are the daily case counts for the for Fulton and for our other metro areas. So basically Decatur, Gwinnett, Cobb. And so you can look at the red line, which is labeled here as Atlanta. So you can see we had a peak around the July holidays, right after the 4th of July, because everyone went out and, without their masks and did things. And then it fell off as often as expected. And then we had another big peak around, this coincided with the holidays, because again, people, they wanted to be with their family and they traveled, and they, we had a big peak of cases associated with the Thanksgiving and the Christmas holidays. And that has been slowly coming down. So that's what this is showing you. And this next slide is what we look at. We call this just our hotspot map. And so we keep track of where the cases are appearing every week. And so that'll help us know where to direct our resources, like the mobile vans that we were doing with CORE and the like. One thing I should bring attention to is the fact that it looks like it's really lighting up a lot. I mean, if you look right at this slide, you would think that there was, you know, a million cases. But what's important here is the fact that is the scale. If you had looked at this, you know, like back in December, we had to use a different scale. So here, red is like, you know, greater than or equal to like 17 cases per square mile, whereas at our worst times, red would have been like greater than 100 cases per square mile. So this is just basically showing us the distribution of cases. So as you see, we have a lot that occur in this kind of corridor, you know, where you see all the red. Now this is just to compare. Sometimes people ask me, well, how do we look compared to Cab and Cobb and Gwinnett? So that's what it is. So you can see that the hottest spots really are kind of in this circle, like in the middle, you know, bordering all of the counties, DeKalb and Fulton and Cobb and Gwinnett. So I'm going to just go, you know, so how are we doing with the vaccines? As you all know, the vaccines first became available in Fulton County on December 17th. I remember because I was the first person to get one at the Board of Health, pushing everybody out of the way because it's that important to get vaccinated. And this is a little bit, this was data as of last week because the vaccine dashboard was down for, you know, for adjustments for almost 10 days now. And they just brought it up this afternoon. And so this is a little bit outdated, but as of this time, in all of Georgia, there are roughly a little of like over 1,500 groups that were official vaccine providers. And we've been allocated over 2 million each of the Moderna and the Pfizer vaccine and about 254 of the J&J. As most of you are probably familiar with the fact that these are different types of vaccines. The Moderna and the Pfizer are the mRNA vaccines that were first approved. They are amazingly effective at about 95% in preventing even mild cases, and they're 100% effective in preventing severe cases and people needing to be, you know, intubated. So the things that you really worry about, they are extremely effective at preventing. The J&J vaccine people are often aware of is that it has a difference in that it is a single dose vaccine. So versus the Moderna and the Pfizer, in which you need to get 2 doses spaced either 3 or 4 weeks apart. With the J&J, you only need to get 1 dose. So a lot of people find that very attractive. And it is about as effective, almost as effective in preventing severe disease as the other 2. So in a way, it's almost, you know, sort of, it's what you want. You know, it depends on, some people want just one, they want to be one and done, and others want to have that little extra margin. And so, you know, we do have different types of vaccines that are out there. So as of the time that this slide was made, over 4 million doses in Georgia had been administered, and that was about 89% of the vaccine that was on hand. If you remember, at the very beginning of the vaccine rollout, there was simply not enough vaccine to meet the demand. So that's where these stories, I mean, you know, people having to spend hours online trying to make an appointment or calling and all that. It was just, I admit, it was kind of nightmarish. And that was simply because there were not enough vaccines available. That luckily has changed. And we now are at the point where we have basically we have the promise of, and we're getting enough vaccines in. So in fact, we have vaccine appointments available through the Board of Health now. You know, people, it's very easy. You can go online at www.fultoncountyga.gov and follow directions there, and you can make an appointment. So that's all really very, you know, that's a great change, and we're all really thrilled about that. So this kind of shows how well Fulton County has done, Fulton County Board of Health has done with pushing out vaccines. And so as of yesterday, at our Mercedes-Benz site, where we are working also in conjunction with FEMA and GEMA, we had done, well, today this will be over 100, at least it's probably close to 125,000 doses that we've done through Mercedes-Benz. And at our North Point location, about over 50,000. And in fact, we hit the 50,000 mark when Congresswoman Lucy McBath was up there, doing a visit. And so we had our 50,000th person was vaccinated while she was there. And then at GICC, which came on later, we are up to near 30,000. And then these other sites, Aviation, Wolf Creek, and these other ones, these are our sites that Aviation we closed down in preference for moving to GICC, but we'd still managed to do slightly under 9,000 there. And we have these mobile units that we are sending out, and we also are working with a pharmacy, Tuxedo Pharmacy. We work with them to go out and to vaccinate people in some long-term care facilities. So we have a lot of things going on. And what you can see is that as of yesterday, we at just a Board of Health had done 220,000 vaccinations. So we're closing in. We'll probably hit 250,000 by tomorrow. So we're really doing exceedingly well just at the Board of Health. This shows the market increase in our vaccinations from day one on the 17th, which we had 0 on the 16th, we ramped up, and this big jump up that you see occurring on the around the 24th of March, that represents the opening of the FEMA GEMA site that is being done in conjunction with us at the Board of Health at Mercedes-Benz Stadium. So when that opened up, that we were able then to start churning out, we can do 12,000 vaccinations a day, not just at Mercedes-Benz, but we could do, including Mercedes-Benz. In fact, we could do more than that because our other sites we're able to do, about 2,000 a day each. So we have a lot of capacity for getting people vaccinated. Where I mentioned before that we are doing mobile vaccinations, and because everyone realized very early on that we needed to do a better job of getting people, particularly people who are disadvantaged and people of color, to get them vaccinated, because as I'm sure all of you are very well aware, COVID is not an equal opportunity disease, and we people of color are affected. We are more likely to become infected with COVID-19 and more likely to die than somebody who is not a person of color. And we were finding early on that because of various reasons, including access and including just a deep-seated what we call vaccine hesitancy, that we were not getting as many people to come in, people of color to come in. So we became very aggressive with our health equity outreach. And there's a number of things that I can tell you that we've done. But one component of this is that we have been going out into the communities to vaccinate people, and we've been working with churches. We have Hispanics have not been getting vaccinated much too, so we've been doing vaccinations through the Mexican consulate and some churches that are primarily frequented both by Blacks and by Hispanics. And so this is just a flavor. Also, we've been working with Fulton County Senior Services to do vaccinations at the senior facilities. And they had have a very nice program in which they were reaching out to every member of these senior facilities to make an appointment for them to get vaccinated and to arrange transport if they needed it, and to, if they needed it, to assign them an escort who would go with them to help fill out the paperwork and the like. So we've been doing quite a bit in that realm, and this just sort of gives you a bit of a flavor for where we've been. And each week we're going to different places. Last week we were at, like, for example, Ebenezer Baptist Church, and that was had quite a number of people who came there. Now I'm going to slightly switch gears to say that we haven't, testing is still going on. And this shows that up till now, cumulatively, Fulton County has done over 1.8 million tests. It's obviously not all of these done by the Fulton County Board of Health, because in fact, the majority are actually done by the hospitals. And in conjunction with, there's a lot of testing that goes on at the university, and of course CVS's and other places. So just to show you though, that testing is still going on. We are over 1.8 million. So in fact, Fulton has pretty consistently accounted for about a quarter of all the tests done in the entire state of Georgia. So there's a lot of testing that's going on in Fulton. So this is to bring you up a little bit up to date about the cases, in that it's broken down into Fulton, Georgia, and the US. And so it's showing you that our average for this over this past week, our average daily report of cases in Fulton has been about 108. And in Georgia, it's been about 857. And in the US, about 66,000 new cases are being reported every day. Now you can look at the graphs here on the side to get a visual depiction. So again, this first hump was the 4th of July holiday. The second hump was were the Thanksgiving and Christmas holidays, and things have been tapering off since then. But we're a little worried because we're starting to see, and you can't really see it here, but we're starting to see a little tick up. And you can see it a little bit better in this, in the one at the bottom of the US cases, where that plateau is starting to show a little tick up. And that's very worrisome. And the reason why, well, let me just go talk also about the deaths, and I'll talk about the worrisome tick up. Usually deaths are what we call a lagging indicator, in that, and it makes sense. In order to die of COVID, you have to first get COVID. So, the case counts would go up first, and then you would see the deaths go up. Now, in contrast to what I just showed you on the last slide, we aren't really seeing as much of a fall off in deaths. Okay, here in Georgia, in Fulton, we're seeing about, our average is about 4, a little over 4. And in the United States, we're still seeing about, over 1,000 people a day. As you know, we're already at the 550,000 mark nationally for deaths from COVID. So, which is really kind of horrific when you think about that. So we're still starting to see deaths, and it's not coming down as you might expect to see from the actual case counts. And there's a good possibility that is because we are seeing a spread now. We're seeing more of what you might have heard of called the variants. And the variants are basically mutations of, that was actually the commissioner of public health, but I will call her back. What was I saying? Oh yes, I was just saying is that we're starting to see more variants. You might have heard about them, like we're first seeing like in Great Britain, there's some in Brazil, some in South Africa, and all that. And these variants are just mutations of the virus. What is concerning is that in general, most of these mutations have been shown to be more transmissible than the regular old COVID that we were dealing with. In some cases, they seem to be associated with a higher morbidity in time. The risk of dying is somewhat elevated with them. And so what this might be, the fact that we have that the death rate is not falling, might be because more of these are due to the COVID variants that are out there. What is good, though, is that the vaccine manufacturers are closely monitoring this. And so we know that the current vaccines are still effective against these variants. What we are in, though, is kind of a race. We're in a race to get as many people vaccinated to knock down the COVID cases and to get as many people vaccinated as possible so that we can prevent a surge coming due to these vaccinations. Our lives are being very made complicated by the fact, though, that many states, including our own, are already opening up wide. And, you walk around, you see people, not wearing masks and not social distancing. And it makes people like me, public health things, public health professionals extremely nervous because we've seen this before. You take your foot off the brake when things start getting better, and then you get a surge. And so I will be advising and reminding everyone that we need to keep up prevention measures until we get to the point where we have herd immunity and about 75% of everyone has been vaccinated. And that'll be the time when we can kind of start breathing easier. This again is just another slide just to sort of show you what cases look like month by month since the beginning of this epidemic. And this again just illustrates is what I was mentioning is that cases have gone down, see that, but deaths have not. So that again is making me kind of worried, is that related to the variants? This is briefly our dashboard. It just shows again, for people who are visual, it shows, the cases coming down, maybe plateauing a bit here, deaths still staying high. This is just our one slide sort of fact sheets about COVID cases. And what I show here is this shows how disproportionately COVID has been affecting people who are Black and Hispanic and the like. And so it's the 46% of deaths have been among Black people. We don't, we have a large number of people, about 60%, that we don't know what their race is. But this has been consistently shown throughout the United States that obviously older people, our average age of death here is about 77. So older people and people of color are more likely to be affected by COVID and to die of COVID. And that's basically what I was going to share with you. And I'm open for questions. I mean, we do get we get a lot of sort of the same questions all the time. So I'm going to maybe try to answer a few of those right now. One question that we get is how effective are the vaccines? And so, as I mentioned before, highly effective. The other thing is that people ask a lot about the side effects. And yes, there are side effects associated with these vaccines. As I've mentioned to others, in a certain case, in a certain way, you can kind of think about them not necessarily as side effects, but almost as features. They're not flaws, but they're features. They kind of show that the vaccine is working. It's kind of doing what it's supposed to do. It's revving up your immune system. And so most of the time when people have these side effects, most of them are mild. Generally, often what I get, for example, is I always get a little soreness at where I got at the injection site. Some people complain of feeling tired or feeling a little fluish. They feel like they've got the flu for about a day or so. And that's actually really quite common. The incidence of having these severe side effects, which is severe allergic reaction, is really very infrequent. It's estimated about 2 to 5 per million injections given. And no one's died of those. And they're generally treated with on-site. It's very rare that anyone even has to be seen by, go to a hospital for that. So it's really, I would take any of those injections, any of those side effects any day of the week over the risk of getting COVID. Because if you get vaccinated, your risk of dying from COVID is about 0. So that's a very important thing to keep in mind. I don't know. Did you want me, Dorsha, to start addressing some of these questions?
I was going to have Daryl Carver,
Okay.
who is with External Affairs, our communication division manager, to read the public comment questions that we had come in. Daryl?
That's right, Dorsha. We have 3 of them. I'll start with the first of them. Stephanie Hudson of Atlanta asked, is the vaccination only good for 6 months? And what is the plan after 6 months? Do we get a vaccination once a year?
Well, what I can say is that, remember, this is a new disease, and the vaccine has only been available since December. What is known is that among the people who were first vaccinated, who were part of the trials, and there were tens of thousands of people who are part of the trials. The vaccine, and those people, many of whom have had them up to already a year, is still effective. So all we can say is, as of now, it looks like they're, it's certainly effective for, at least 6 months to a year. What we don't know is if this will end up being more like the flu vaccine, the seasonal flu vaccine, in which you need to have a booster every year, or if it's going to be more like the measles vaccine, in which you get it, a couple of times and you're good for the rest of your life. We simply don't know. So the way we'll find out is with the passage of time, as people are, so it's being actively followed. And so, and the wonderful thing about these vaccines is that they are, I'm not going to get too wonky about it, but they're relatively easy to make. I mean, and some of the older vaccines that you had to grow them up in eggs, you had to culture, you had to have, huge vats of this stuff, and it was really hard. No, these things, they can make a few adjustments on a computer, and then they can read and they can generate, this new vaccine or this new whatever. So it's like, what if it's determined that it needs that a booster needs to be given for whatever reason, they can pretty much churn that out pretty quickly. So this might end up being like the seasonal flu. I've never found it a problem. I get the seasonal flu vaccine. My family gets it every single year. Just go to our local Publix. They give me a $10 gift card too if I get it. So hey, I mean, like I make out every year. This might turn out to be like that. So anyway, as soon as we know, we'll be obviously letting everyone know about that. But for the moment, it's good. I mean, no one has needed to be re-vaccinated because of waning efficacy.
Okay, thank you, Doctor. The next one I have is more of a facilities issue regarding how they're being administered. Why are disabled and elderly waiting in line at Georgia International Convention Center? I feel like if you're on oxygen and in a wheelchair, you should get first priority and not have to wait 2 or 3 hours for a vaccination. Can this location get something in place for them? That's from Harriet Campbell of Atlanta.
Mm-hmm. Well, actually, you know what? We time these things, so I actually do know what the usual wait time, processing time is. The usual processing time. Remember, this also includes the 15 minutes that you have to stay after you have the vaccination for observation. Our usual processing time actually is only 25 minutes. Now, I'm the first to admit that we've had our share of snafus. There was a couple of days when we were overbooked. And it wasn't caught until late. And yes, people did have to wait. But I think we really responded as well as we could to that. So really, it's not really fair to say that people are customarily waiting 2 and 3 hours, because they're not. They're usually only there for 20, at the most 25 minutes. And that includes the time that they have to wait to post vaccination and to make their new appointment. And yes, when we see if they see anyone there who is clearly needs to be put through earlier, then we absolutely do. But as you might understand, particularly at the beginning of the vaccine rollout, the only people that were not the only people, of course, healthcare workers were eligible. But other than healthcare workers, the only people who were eligible were over 65. So there were a lot of people who had special, who had special disabilities and needed special care. But now that it's open to all, and anybody over the age of 16 can be vaccinated. Of course, if we see somebody who needs special treatment and all that, then they are that we basically, yes, we do put them up at the front and move them through. But I don't want anybody to be scared off. It is untrue that you should expect to be there for 2 or 3 hours. You will probably be there in and out in under 30 minutes.
We have 2 more questions. One just came in since we've been talking. This is for Donna Lawson. Recently, the public had an opportunity to look at the footage of the redesigned Central Library from Commissioner Arrington's recent visit. It appears as if the building needs COVID spacing considerations. Will changes be made prior to the building opening for staff and for patrons? Is the vaccine effective against variants of COVID. Well, that's the next question, Bob. We'll go into that one next. But this one specifically, I think, Dorsha, you might be better equipped to take this one because I know you were part of that visit.
Yes, so we did an internal tour of the central library as it has been renovated. However, it is not open to the public as of yet. It won't be open till possibly November of this year. And when it is open, they are going to take all COVID-19 precautions. Currently, as you know, as you saw in the footage, that we were just doing a tour and there was no one there. But I did ask that question while I was there with the director, Gail Holloman, to ask, are there going to be, the hand sanitizers, there's going to be places where, people know to distance themselves, whatever. And she said all of that will be taken into consideration when they do plan to reopen, and there will be limited spaces. Like they won't have people sitting right next to each other with computers, right? You have to move one over, and they will be monitoring that, and we'll have security on every floor.
The last of the questions I have, I think this is much more of a medical question, so I think this one's for Dr. Paxton. Is the vaccine effective against the variants of COVID? It's a multi-parter, so bear with me. Is the vaccine effective against variants of COVID? And also, is it a requirement to show proof of having taken the vaccination in order to travel abroad and into U.S. territories such as the Virgin Islands and Puerto Rico? And where can I sign up?
Okay. Yeah, so far the current vaccines are effective against the current variants. That's the short answer for that. The second question was about, I'm sorry, I've got a short attention span. What was that?
Is it required to show proof of having taken the vaccination in order to travel abroad and into far-flung U.S. territories such as the Virgin Islands and Puerto Rico?
Well, within the United States, and it is not. However, the thing is, we don't control, like, for example, what France is going to want. So it's always possible that either a carrier or an airline or, a country might, want to see that at some point in the future. I'm not aware, but of what countries might be asking for that right this minute. Probably the place to look for that would be on the State Department, U.S. State Department website, because they usually keep for every country. They talk about what the requirements are, and they talk about what the current COVID risk is and whether or not a COVID test is required. So my guess is that that's where they would probably put up whether or not any countries are requiring vaccination. But my guess is that they're not yet at that point where they're saying you need to show proof of vaccination to be able to get in. But who knows? It might come down. That might come down the pike. At the moment, I'm not aware of any businesses that are requiring proof of vaccination. For example, to return to work or the like. But I can't say what's going. What the future may hold. There is a long-standing history of using proof of vaccination for many things. Like all of our kids had to show proof of immunizations before starting school. I, as a healthcare worker, when I was practicing at the Decatur VA in the ID clinic, I had to get vaccinated against seasonal flu every year as a condition of working there. So, I can't say what the future will hold, but there is a precedent for using proof of immunization for certain things like work, for certain work situations. And the last part of that question was?
Where can I sign up to be vaccinated?
You can go to the website, www.fultoncountyga.gov, and then just sort of follow the leads. It'll say, sign up here for a COVID appointment. If you are not comfortable using the on the internet, or you don't have access, or for whatever reason, you can also call our hotline, which is a simple number. It's 404-613-8150, and someone there can on the line can help you.
Actually, that's all the questions I had. Thank you.
I had a couple of questions that came in as well, Dr. Paxton. One of them is Fulton County Board of Health still giving COVID-19 testing And if so, where? How does a person find out where?
Well, again, the best site to find out what's near you is to go to the same site that I mentioned, fultoncountyga.gov, and it'll have a list of where to find COVID testing near you. We at the Board of Health, we've kind of moved over more into vaccination, and our sites are still there. And one of our, like for example, our site up at North Point, which is run by CORE, the community organized relief effort. So they're actually running that site up there. Our sites in that were more in the central area, such as at our central site at 265 Boulevard, is now being run by a lab company, Mako, which is also running one of our sites that was at Wolf Creek. So those sites are still open. They still operate exactly the way that we used to operate. You can go, you can get your test. A question comes up, you will be asked, these tests are free, just like the vaccines are free, but to everyone. So you don't need to have insurance. But what we do is we ask for people who do have insurance, if you can bring proof of your insurance, because we at the Board of Health, for the vaccinations, we can get a small administration fee that is not charged to the patient, it's charged to the insurance company. And that's what allows us to continue these programs in order to, be able to afford, because as you can imagine, vaccinating nearly 250,000 people is a huge undertaking. And so every little bit helps. So I just want to stress, you do not need identification. You don't need to have a social security number. You don't need identification. You don't need insurance. These are free. You don't even need to be, you don't have to show proof of citizenship or anything like that. People often ask that. You don't need to show proof of citizenship or anything like that. It's just that, but we do ask for insurance information if you have it, because it helps us. And so that's why we ask for insurance.
Also, do you have data on reinfection rates?
Well, what we is that we've known that what we call natural infection, that means among people who got COVID, that generally for about 90 days or so afterwards, there's some natural immunity in which they're much, unlikely to become infected again. However, that clearly wanes because there have been reports of people who were known to have been infected with COVID, who then get another case of COVID, usually after sometime after 3 months. So what we do know is that the immunity, there is a small amount of natural immunity that comes from having been infected with COVID, but it doesn't necessarily last. What lasts, or what we do know is, we know that the immunity that comes from vaccination is more durable and more effective. So that's why we say, even if you've had COVID, you should go get immunized. You should get vaccinated. So we have, tons of people who have had COVID before, and we say, yeah, go in, come on in, and we vaccinate them. So the only thing is, if you've got an active case of COVID, if you've, you're still febrile or whatever, we say, wait until you're over the active part of the infection, and then come and get vaccinated.
Okay. And how effective is the rapid testing? Some people are saying that they went and got it, paid for it, and it was like a false negative or false positive or something or whatever. Or is that just an error that happens in all testing?
Well, it depends on which rapid test you're talking of. But in general, you can pretty much trust if a rapid test comes back as positive, we treat that as a positive. So that's you're done. However, it does have rapid tests in general have a higher rate of what we call false negatives. So in fact, if you follow the rules, anybody who has a negative rapid test is supposed to then go on and have a PCR test to determine whether or not that's a true negative or not, which is one reason why at our testing sites, we would do PCRs, except for for somebody who was having active, because also I should mention, that the rapid tests are more reliable among people who are having symptoms and are within the first week of having symptoms, okay? If you go up beyond a week, then the test becomes less reliable. So at some of our sites, what we would do, it was really a way, when we had large numbers of people coming through and, had to, and our funding was being taken away from us at that point. We would, if somebody had active symptoms, we would give them first a rapid test, which cost like $5 or something like that. And if it came back positive, fine, you stop there, you're positive, you're done. But if the rapid test was negative, then we would do a PCR test right then and there, because that is what the recommendation is that if the test is negative, you get a PCR. So, so it's basically the PCR is the gold standard, not the rapid test.
Okay, and one last question. Is it possible that, or do you know that the number of people being tested for COVID has declined, so therefore the number of COVID cases, positive cases have declined because less people are getting tested?
Well, it certainly plays into it, but there's another thing we look at when we're doing testing, and that's called the percent positive. So that means that let's say the percent positive is of every 100 tests that you do, if 5 are positive, then that's 5% test positivity. If 20 are positive, then it's 20 of those tests where we're positive. And that correlates, the higher that is the number that actually correlates with actual spread. So when we were in our worst days, back around the 4th of July holiday, back in, right around after Christmas, we were having not only large numbers of cases, but our test positivity was getting as high as like 20%. There are some places in the rest of the United States that are having outbreaks with really uncontrolled, where things have gotten as high as 40%. Now that means that you've got a really raging epidemic. At the moment, our test positive, our percent positive has been falling. So I think that reflects that we are doing fewer tests because fewer people are being infected, and with our percent positivity, our percent positive being about 5%, that's sort of on the cusp. It's falling, which is really good. But the thing is, in the last couple of weeks, it's sort of stayed at 5%. We want to get it down to like less than 1%. Or the like. It's sort of staying at around 5%. So I think this decrease we're seeing is a true decrease that we are having. And think about it, that's not unexpected. This is a respiratory illness. When you're moving into the spring and the summer months, that's when the respiratory illnesses. How many times have you had a bad flu in May or June? You don't. You usually have bad flus in the winter months. So this is kind of what respiratory illnesses do, but it is giving us some breathing room in terms, I guess with respiratory illness, breathing room, but anyway, it's giving us some breathing room to work harder to knock down the COVID cases and to get as many people vaccinated, because winter is eventually going to come back. And in the fall is when you normally start to see respiratory illnesses go up. So what we really want is that we want to get as many people vaccinated as possible. And actually, we really want to do it. The Biden administration has basically set a goal of having having people, so that we could, of July 4th as being the time when things return more to normal, because people have gotten vaccinated. And I think that's a very worthy goal. I want to have a good summer. I think, doesn't everybody? And the only way that we're going to do that is if people go out and get vaccinated, because if they don't, then we'll still have these pockets of infection and this pool of people who are susceptible to it because they have not been vaccinated. And it's going to be a setup for when the fall comes and we normally start seeing colds and flus. That could be a time when, then COVID cases could start taking off just as they did before.
So Dr. Paxton, and wrapping up, do you have any advice to give to those who have now received either their 1 dose or their 2 doses, as far as is this like, okay, well, now you're free, don't worry about COVID anymore? What would you want to share with them?
Well, I mean, I think there is a benefit. Obviously, there are some goodies you get if you're fully vaccinated. The CDC has just announced what those goodies are. That is that if you're fully vaccinated, you can pretty much mingle with other people who are fully vaccinated, and you don't need to social distance. You don't need to, to wear a mask. So, for example, I celebrated with some other friends who, when we were all fully vaccinated, we had a dinner party, still small, but, and none of us needed to be masked because we were all fully vaccinated. The other goodie that you get is that if you are fully vaccinated and you happen to come in contact with somebody who is COVID positive, if you're a contact of a COVID positive person, you don't have to quarantine. So you don't have to take, 10 days off and stay home and blah, 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 because you're fully vaccinated. So there are definitely perks, that people can see or feel. I mean, I even feel more confident, going to a restaurant because, all that. But if you see me in a restaurant, you're going to see me with this on. I'm still wearing my mask when I'm out. When I'm out, I'm still socially distancing. I'm still doing all those things that we need to do to keep the COVID cases down. I can just breathe a little easier at night. I can sleep a little easier at night, knowing that I've taken this step to, protect not only myself, but my family. My family's all vaccinated now. And and my community. So we all need to be doing this so that we can all breathe easier. Particularly when the summer comes. I want to have a great barbecue, and I don't want to have to be wearing the mask.
Yes, and I would love to join you for that barbecue without a mask. No, just joking. Well, thank you so much for your time. We really appreciate you taking this time to educate us and our constituents with all of that knowledge you have. Our certified epidemiologist. You are, right?
I am.
And we'd like to thank you, the viewing audience, for being here with us. If you have any questions, you can send them to me at Dorsha, DORSHA.Simmons, SIMMONS, at FultonCountyGA.gov, and I will send them to Dr. Paxton. In the meantime, please do stay tuned. We have other events coming up. Visit our website at FultonCommission5.com. And we'll also have another town hall in July to discuss the tax assessment. So until then, good night and God bless.
Thank you.